If you are living with elevated lipoprotein A, there are several important things to watch beyond your lab results. Of course, blood work, as discussed in my last video, is important too. But diet, activity level, sleep, and stress also play a major role in cardiovascular risk, and we will be covering those areas in more detail in separate lessons. But in this video, I want to focus on some of the other factors that can shape your overall risk. Some are obvious, some are easier to overlook, and some may be things you have never connected to heart and vascular health before. When lipoprotein A is elevated, these areas deserve closer attention because they can add to the strain on your arteries, increase inflammation, signal existing vascular disease, or help you and your healthcare provider understand how proactive your prevention plan might need to be. Hi, I'm Valerie. I'm a registered nurse and health educator specializing in cardiovascular risk reduction. And this is the third video in my series on how to lower your risk when living with elevated lipoprotein A. In this lesson, we will be looking beyond the lab report and talk about what else to watch when lipoprotein A is high. Some of these you can directly change. Others you cannot change, but they still need to be understood. Together, they can complete the cardiovascular risk picture when lipoprotein A is high. The first area I want to talk about is blood pressure. And I am going to spend a little time on it because blood pressure is one of the most important cardiovascular risk factors. When lipoprotein A is elevated, it deserves serious attention and becomes one of the most important numbers to know, track, and manage. Lipoprotein A can contribute to plaque buildup, vascular inflammation, and clot-related risk. High blood pressure adds another layer of stress by increasing the force against the artery wall every time the heart beats. Over time, that extra pressure can damage the lining of blood vessels, increase arterial stiffness, enlarge the heart, strain the kidneys, and raise the risk of heart attack, stroke, heart failure, kidney disease, and cognitive decline. Blood pressure is made up of two numbers. The top number is called systolic blood pressure. This is the pressure in your arteries when your heart contracts and pushes blood out to the body. The bottom number is called diastolic blood pressure. This is the pressure in your arteries when your heart relaxes between beats. The top number often gets more attention, especially as people get older, but the bottom number also gives important information about the pressure your arteries are under between heartbeats. For most adults, normal blood pressure is considered less than 120/80. I'm going to put the current American Heart Association blood pressure categories on the screen so you can see how normal, elevated, stage 1 and stage 2 high blood pressure are defined. These categories were important because the current guideline recognizes increased cardiovascular risk beginning below that older 140/90 threshold. The 2025 guideline also identifies less than 130/80 as the general treatment goal for most adults, with individualized decisions for certain situations. But even if your blood pressure is often in the elevated stage or stage 1 range, it is worth paying attention earlier while there may be more opportunity to bring it down. The American Heart Association recommends home monitoring for people with high blood pressure. The AHA also recommends an automatic cuff-style monitor that goes on the upper arm rather than a wrist or finger monitor, because wrist and finger monitors tend to be less reliable. If your blood pressure is elevated, borderline, changing, or if medication is being considered, home monitoring can be very helpful. It can show patterns that one office reading may miss. Some people have higher readings in the office because they are anxious or rushed. Some people have higher readings at home than they do in the office. And some people have readings that can vary quite a bit depending on sleep, stress, caffeine intake, exercise, pain, alcohol, sodium intake, or even just the time of day. There is no single home monitoring schedule that fits every person, so this is something to discuss with your healthcare provider. In general, if your blood pressure is normal and you are just keeping an eye on it, checking periodically may be enough. If your numbers are elevated, if medication is being adjusted, or if you are trying to understand your true pattern, your provider might have you check more often for a period of time. If you are choosing a home monitor, look for a validated automatic upper arm cuff. A good place to check is validatebp.org, which lists blood pressure devices that have been validated for clinical accuracy. It is also important to choose a cuff that fits your arm correctly because the wrong cuff size can give inaccurate readings. I will put more information on sizing in the printable resource that accompanies this video lesson. If possible, bring your monitor to a medical appointment so your healthcare team can compare it with their reading and make sure that you are using it correctly. How blood pressure is measured can affect the reading. At home and in the office, the basic technique, as standardized by the American Heart Association, should be the same. Sit quietly for at least 5 minutes first. Keep your back supported, feet flat on the floor, and legs uncrossed. The cuff should be on your bare upper arm with your arms supported at a heart level. Try to avoid caffeine, nicotine, exercise, and rushing around right before the measurement. And empty your bladder first. During the reading, stay still and do not talk. The American Heart Association also recommends taking more than one reading because repeated readings are usually more useful than a single measurement. This is especially important in a doctor's office if medication is being considered. If your blood pressure is checked over clothing, with your feet dangling or your legs crossed, while you are talking, right after you walked in, or with the wrong cuff size, the number can be misleading. You can absolutely ask for it to be rechecked after you have been sitting quietly with the correct cuff and your arm supported. That does not make you a difficult patient. It makes sure that an important medical decision is based on an accurate measurement. And when it comes to improving blood pressure through lifestyle, sodium is only one part of the picture. Cutting back on salt can help, especially for people who are salt sensitive. But blood pressure is affected by many factors. Ultra-processed foods, added sugar, low potassium intake, excess alcohol, weight changes, poor sleep, sleep apnea, chronic stress, physical inactivity, pain, and some medications can all play a role. In the diet lesson, we will talk more about eating patterns that support cardiovascular health, including the DASH diet. And in other lessons, we will talk more about movement, sleep, and stress. For now, the main point is that blood pressure is one of the most important areas to watch when lipoprotein A is high, because it is one of the areas where action can make a meaningful difference. And if your healthcare provider recommends blood pressure medication, please know that needing medication is not a personal failure. It does not mean that you did not try hard enough, that you waited too long, or that you did something wrong. Blood pressure is influenced by age, genetics, kidney function, hormones, vascular stiffness, and many other factors. Lifestyle is powerful, but some people still need medication to get into a safer range. Please do not avoid medication because you think it says something about your effort or your character. The purpose of treatment is to protect your arteries, your heart, your brain, and your kidneys. The next area to watch is waist measurement and weight trends. I want to talk about this carefully because this subject can feel personal for many people. Here, we are looking at waist measurement and weight trends through the lens of cardiovascular risk, metabolic health, and reducing strain on the body, with compassion, not judgment. I know just how difficult this battle can be. When we are thinking about cardiovascular risk, where body fat is stored can give us useful information. Fat stored deeper in the abdomen, often called visceral fat, is more metabolically active than fat stored just under the skin. Higher amounts of visceral fat are associated with insulin resistance, higher blood pressure, abnormal triglycerides, lower HDL cholesterol, chronic low grade inflammation, and higher overall cardiovascular risk. This becomes important when lipoprotein A is elevated because any sign of metabolic strain can add to the overall risk environment. One simple way to get a general sense of abdominal fat is waist measurement. For many adults, a waist measurement above 35 inches for women or above 40 inches for men is associated with higher cardiometabolic risk. These cutoffs are general screening numbers, and they do not tell the whole story for every person, but they can be a useful place to start. Waist to height ratio is another simple tool. A common goal is to keep your waist measurement less than half your height. So if someone is 64 inches tall, that would mean aiming for a waist measurement under 32 inches. This is another screening tool that can sometimes give more useful information than weight alone. Watching weight trends can also be helpful, especially when you are looking at change over time. A gradual increase in weight, especially around the abdomen, can be a sign that blood pressure, blood sugar, insulin resistance, triglycerides, or inflammation might also be shifting. On the other hand, even modest weight loss can sometimes improve blood pressure, blood sugar, triglycerides, and overall metabolic health. So I would encourage you to think about waist measurements and weight trends as information. They are pieces of the overall risk picture. If lipoprotein A is elevated, these measurements can help you and your healthcare provider better understand whether metabolic risk is also adding to the picture. If you choose to track your waist measurement, try to measure it the same way each time. Use a flexible tape measure. Measure around the abdomen at about the level of the belly button or just above the hip bones. Keep the tape snug but not tight, and measure after breathing out normally. The exact method can vary slightly depending on the guideline being used, but consistency is what makes it useful for tracking your own trend. In the diet lesson and the movement lesson, we will talk more about how to improve body composition and metabolic health in a realistic way. For this lesson, the main point is that waist measurement and weight trends can give additional information about cardiovascular risk when lipoprotein A is high. I also want to pause here and acknowledge something important. If weight has been a lifelong struggle for you, hearing one more person talk about weight in the context of heart risk can feel discouraging. Many people have spent years being told to try harder, eat less, move more, or just be more disciplined. That message can cause a lot of shame, and it ignores how complex weight regulation really is. We are now starting to understand much more about the biological drivers of appetite, fullness, cravings, weight gain, and weight regain. Many different factors, including hormones, stress, medications, emotional coping patterns, trauma history, habits, and food environment can all play a role. So if waist measurement, weight, or other metabolic factors are adding to your cardiovascular risk, please know that this is a medical conversation, not a character judgment. There is not only now more understanding, but there are also more options than there used to be. For some people, nutrition changes, movement, sleep improvement, stress support, and habit based strategies make a difference. For others, medical treatment might also be appropriate. That can include medications that target appetite and weight regulation, such as GLP-1 receptor agonists, depending on what you and your healthcare provider decide. These medications are not right for everyone, and they should be discussed with a qualified healthcare professional. If you have struggled with weight for a long time, it is reasonable to ask what options are available now. Getting help is not a failure. The goal is to reduce risk and protect your long-term health. The next area to watch is oral health. This might seem like a strange thing to include in a lesson about lipoprotein A, but oral health and cardiovascular health are connected more than many people realize. The strongest connection is with gum disease, also called periodontal disease. Periodontal disease is a chronic inflammatory condition that affects the tissues around the teeth. When the gums are inflamed or infected, bacteria and inflammatory signals can enter the bloodstream. Periodontal disease has been associated with cardiovascular disease, including conditions related to plaque buildup in the arteries. The American Heart Association updated its scientific statement on this connection in 2025, and the evidence continues to support an association between periodontal disease and atherosclerotic cardiovascular disease. Gum disease is another source of chronic inflammation that can add to the overall cardiovascular risk picture. Pay attention to signs like gums that bleed when you brush or floss, persistent bad breath, gum recession, loose teeth, pain with chewing, or being told that you have gingivitis or periodontal disease. If any of those are present, it is worth following up with a dental professional. Actions that improve oral health and prevent gum disease are basic but important. Brush regularly. Clean between your teeth with floss or another tool your dentist recommends. Keep up with dental cleanings and treat gum disease early. Hydration also supports oral health because saliva helps protect the teeth and gums. If you deal with dry mouth, especially from medications, mouth breathing, CPAP use, diabetes, or other health conditions, bring that up with your dentist or healthcare provider because dry mouth can increase the risk of cavities, gum irritation, and oral infection. The health of your mouth can reflect and influence the health of the rest of your body. When lipoprotein A is elevated, oral health is one more area where consistent care may help lower the overall burden on your vascular system. The next area to watch is smoke, nicotine, and other inhaled exposures. Smoking is one of the most well-known cardiovascular risk factors, but it is worth looking beyond current smoking. Past smoking, vaping, secondhand smoke, and repeated inhaled exposures can also affect the heart and blood vessels. Tobacco smoke can damage the lining of the blood vessels, increase oxidative stress and inflammation, make blood more likely to clot, and contribute to plaque buildup. Secondhand smoke exposure has been associated with higher risk of coronary heart disease and stroke. If you live with someone who smokes, or if you spend time in smoke-filled environments, or have regular secondhand smoke exposure at work, make sure that your healthcare provider knows. That exposure can affect cardiovascular risk, even if you are not the person smoking. Reduce exposure to secondhand smoke as much as you realistically can. That might mean keeping your home and car smoke-free, asking others to smoke outside and away from doors or windows, avoiding indoor spaces where smoke is present, adding air filtration when exposure is hard to avoid, or asking about workplace protections if the exposures happen at work. If you have a history of smoking, even if you quit years ago, tell your healthcare provider. Quitting is one of the best things that you could have done for your heart and blood vessels, but your past exposure can still help your doctor understand your overall risk. Tell them how long you smoked and about how much you smoked during that time. Vaping is sometimes discussed as if it is less harmful, but nicotine exposure of any kind can raise heart rate and blood pressure, and inhaled substances can affect the blood vessels and lungs. If you vape, use nicotine products, or are trying to quit, talk with your doctor about support options. I also want to mention other inhaled exposures as they can add to risk, especially if they are frequent or long term. This can include wildfire smoke, heavy air pollution, wood smoke, occupational dust, fumes, diesel exhaust, chemical exposures, or work around smoke, solvents, welding fumes, or fine particles. These exposures might affect the lungs and cardiovascular system, especially through inflammation, oxidative stress, and effects on the blood vessels. Reduce avoidable exposure where you can. Use good ventilation. Wear appropriate protective equipment at work. Check air quality during wildfire smoke events, and consider indoor air filtration when needed. If you currently smoke or vape, support is available. Counseling, nicotine replacement, prescription medications, quit lines, and structured programs can all help. Nicotine is highly addictive, and needing support to quit is common. Getting the support you need is a health protective step. The next thing I want to cover is symptoms to be on the lookout for. When lipoprotein A is elevated, it becomes especially important to tell your healthcare provider about symptoms that could point to heart disease, peripheral artery disease, vascular problems, or aortic valve disease. That includes chest pressure, chest discomfort, unusual shortness of breath, a noticeable drop in exercise tolerance, dizziness or fainting with activity, or feeling unusually fatigued with exertion. It also includes symptoms in the legs, leg pain, cramping, aching, heaviness, or fatigue that comes on when you walk and improves when you stop, can be a sign of peripheral artery disease. Peripheral artery disease means that there is reduced blood flow to the legs, usually because plaque has built up in the arteries outside the heart. Some people feel this in the calves, but it can also show up in the thighs, hips, or buttocks. Coldness in one foot, color changes, slow healing sores, numbness, weakness, or decreased pulses in the feet should also be reported. For men, erectile dysfunction can also be a vascular warning sign. This can feel uncomfortable to bring up, but it is medically relevant. Erectile function depends on healthy blood flow, and erectile dysfunction can sometimes show up before more obvious signs of cardiovascular disease. If this is something that you are experiencing, especially if it is new or worsening, please tell your healthcare provider. I also want to mention here symptoms that could relate to the aortic valve. Lipoprotein A is best known for its connection to plaque buildup in the arteries, but it is also associated with aortic valve stenosis. That means that the aortic valve, which controls blood flow from the heart into the aorta, can become thickened, stiff, and narrowed over time. Researchers believe lipoprotein A may contribute to this process partly because it carries oxidized phospholipids, which can promote inflammation and calcification in the valve tissue. The most important symptoms to mention to your healthcare provider are chest pressure, shortness of breath, dizziness, lightheadedness, fainting, or a noticeable drop in exercise tolerance, especially with activities. These symptoms can have many possible causes, but no matter what the cause might be, these symptoms deserve medical attention. Some of these symptoms can be easy to dismiss, but if you have elevated lipoprotein A, your healthcare provider needs to know about symptoms that could suggest existing plaque, reduced blood flow, or valve disease. The next area to think about is your own personal medical history. Some parts of your health history can change your cardiovascular risk, especially when lipoprotein A is elevated. These are the kinds of things that your healthcare provider needs to know about, even if they seem unrelated. For women, this includes premature menopause or early surgical menopause. Estrogen changes can affect blood vessels, cholesterol patterns, body composition, and cardiovascular risk over time. If you went through menopause before age 40, had your ovaries removed at a younger age, or had an early menopause for any reason, make sure your healthcare provider knows. Pregnancy history can also provide important cardiovascular clues. A history of preeclampsia, gestational diabetes, pregnancy-related high blood pressure, preterm delivery, or having a small for gestational age baby can be associated with higher cardiovascular risk later in life. These complications may have happened years ago, but they still belong in your health history. Thyroid disease is another one to mention, especially hypothyroidism. Low thyroid function can affect cholesterol levels, energy, weight, blood pressure, and overall metabolic health. If your cholesterol has been difficult to control, or if you have symptoms that could fit with thyroid dysfunction, it is reasonable to ask whether your thyroid has been checked. Chronic inflammatory or autoimmune conditions are also important to include here. Conditions like rheumatoid arthritis, lupus, psoriasis, inflammatory bowel disease, and other inflammatory diseases can add to systemic inflammation and cardiovascular risk. If you are living with one of these conditions, your cardiovascular prevention plan may need to take that into account. Cancer treatment history can also be relevant. Prior chest radiation and certain chemotherapy or targeted cancer therapies can affect the heart and blood vessels. If you have had cancer treatment in the past, especially treatment involving the chest area, include that in your cardiovascular history. A history of blood clots, stroke, a TIA, often called a mini stroke, peripheral artery disease, kidney disease, or any known vascular condition should also be mentioned. These details can help your healthcare provider understand the full picture and decide how closely you should be followed. Your medical history can reveal patterns, exposures, and life events that help guide a more complete prevention plan. The next piece to talk about is family history. This is especially important with lipoprotein A because lipoprotein A levels are largely inherited. If you have elevated lipoprotein A, there is a real possibility that a parent, sibling, child, or other close relative can also have an elevated level. Family history can also give clues about how cardiovascular risk has shown up in your family over time. Make sure that your healthcare provider knows about close relatives who have had an early heart attack, stroke, stent, bypass surgery, sudden cardiac death, peripheral artery disease, or aortic valve stenosis. Early cardiovascular disease usually means before age 55 in a male first-degree relative or before age 65 in a female first-degree relative. A first-degree relative means a parent, sibling, or child. It can also be helpful to ask about relatives who are told they have very high cholesterol, familial hypocholesterolemia, high lipoprotein A, unexplained heart disease at a younger age, or valve disease that required monitoring or replacement. This might also be a good time to talk with family members about lipoprotein A testing. Many professional groups recommend that close relatives of someone with elevated lipoprotein A be tested at least once, because this is a genetic risk factor that standard cholesterol testing can miss. The purpose of knowing your family history is to bring more clarity to your prevention plan. A strong family history can change how aggressively other risk factors are managed, how closely you are followed, and which additional tests your healthcare provider might consider. When you are living with elevated lipoprotein A, your lab numbers are important, but your overall cardiovascular risk is shaped by many other things. Some of these areas give you direct places to take action. You can monitor your blood pressure. You can improve your oral health. You can reduce your smoke exposure. You can bring up symptoms early and make sure that your healthcare provider has a complete picture of your health history. Other factors like age, family history, premature menopause, pregnancy-related complications, or past medical conditions may already be a part of your story that you cannot change, but they can still help guide prevention. The value of looking at all of this together is that it gives you and your healthcare provider a clearer picture of your risk. It can help guide decisions about how closely you should be followed, what numbers need more attention, what symptoms deserve evaluation, and how aggressive your risk reduction plan needs to be. In the next video lesson, I will be talking about one of the most important lifestyle areas for cardiovascular risk reduction, nutrition. I will be sharing how diet can support better blood pressure, blood sugar, inflammation, cholesterol patterns, body composition, and overall vascular health. Even though diet does not directly erase the genetic lipoprotein risk, it is still important. If you found this lesson helpful, please give it a like. Make sure you subscribe and turn on notifications so you know when the next lesson is available. I will also include links to the other lessons in the description so you can follow the course in order or choose the lessons that are most relevant to you. Thank you so much for watching, and please take good care of yourself.